the other day general supplements that were produced without any research or accurate application, and I think there were 30 separate advertisements, all saying veterinary approved is the best thing for treating this condition, not a jot of clinical evidence that they actually work. What does the skin do for us? It is the biggest organ of any animal, including ourselves and the horse. So primarily it's a retaining barrier. It holds the shape, holds the internal organs in, and gives the outward appearance of the horse, which is important for its recognition with other horses, sexual contact between mares and stallions. It involves in protection, and that's physical protection from cuts, wounds, bites from insects, from the sun's rays, from sunburn. It also provides antibodies, so combats infections. And next to production, this is the production of hair, hoof, much more important for horses than for us. Obviously the hair is important in, again, its protection, temperature regulation of the horse. The hooves allow it to move without damaging its structures of its feet. So all that's produced by the skin. Temperature regulation. Skin control has a major input in controlling the internal temperature for the optimum function of the horse. That includes sweating to reduce the temperature, shivering to increase the temperature. That's muscle contraction generating heat. It's a massive storage organ. It can store fats, vitamins, minerals, glucose, glycogen for energy. So it's supporting all the other functions in the body. The brain, the liver, the kidneys, the heart, are all supported by the skin. What indicator? It's an indicator of health or disease. Often a diseased horse will have changes in the skin. If it's got liver disease, it may be jaundiced, have a yellow colour to it. A dry, scurfy coat may indicate systemic illness such as liver disease. Kidney failure as well, and some tumours can cause ulceration and damage to the skin. It produces pigment, which is essential for protection against ultraviolet light and sunburn. And again, it helps the reflection of the sun's rays to control heat. Antimicrobial action. Apart from allowing antibodies to pass onto the skin, it secretes a number of other products such as the sebaceous fluid, which has antibacterial effects and helping to protect against infection gaining entry into the body. Sensory perception. It's one of the biggest sense organs an animal has got. So it has pain receptors, has touch receptors, it has chemical receptors looking for changes in chemicals touching the body, heat receptors. So it's a massive help to the horse to tell it where it is, what's likely harmful to it, and help protect it. Secretion, excretion. Excretion is removal of products from the body, and the sweat can remove toxic waste products from the body just as much as urine and feces can. And secretion, it produces sebum, which helps us secreting products onto the skin to keep it supple and help protect it. And finally down there, we've got vitamin D production. I think most of you have probably heard about hypovitaminosis D in children that spend too much time indoors, and that produces rickets. So the action of sunlight on the skin naturally produces vitamin D, and that supports calcium and bone production. So a microscope view of the skin, quite low power. And we can see it here. This is it. The E is the epithelium. The D, this layer here, is the dermis. So it's two layers of cells. Below this we have hair follicles. These are the apocrine or sweat glands, so these dark circles here. And then we have the sebaceous glands. So the sweat glands are producing sweat to help cool the body. The sebaceous glands are producing sebum, which keeps the skin surface moist. The next slide is a bit of a higher powered one. Haven't actually got any hair follicles on here, But you can see this is the surface keratin layers of the skin, these lines across here, with the epithelial cells. And the black arrow there, it's pointing to a cell with a dark nucleus. That's what we call a melanocyte, and that's responsible for the pigment, the colour of the skin. And below it is the dermis. Try to group the conditions affecting the skin into these groups. I'm not going to go through every single skin disease because they're endless. What I'm going to do is try and talk about the common things that you're likely to encounter in your horse, about how to recognise them, how we're going to diagnose them, and what the treatment options are. So, what we're going to, the first group we're going to talk about is bacterial skin disease. And this is actual bacterial infection on the skin. And the first one here is a classic thing we'll see in the winter, is rain scald. Its usual appearance is tufts of hair with a scab around them that can lift off, and you'll have a fussy appearance underneath. So this is the flank of a horse, and it's got numerous areas of this spot. As the name suggests, it's typically associated with wet conditions. So it's a bacteria that likes to grow in damp conditions. The proper name for it is Dermatophilus congolensis. It does happen in rugged horses as well. I've had quite a number of horses that have been left out with rugs on, and they get damp underneath the rugs, and they can get quite horrendous rain scald. Horses that also run down, so horses that are thin or have other diseases, are more prone to develop this. The immune system doesn't seem to protect them so well, so we see some horrendous rain scald in thin horses. This is a bit of a closer view, and you can see a clump of hair is lifted off, leaving the bare area beneath it, and often in a fresh bit you'll get some yellow pus material. Although it looks horrendous and it can cause very extensive lesions, it's very, very easy to treat. We can usually diagnose it by putting one of the scabs we've removed off there, put it onto a microscope slide, and it's very easy for us to see under the microscope the bacteria. It's sensitive to simple penicillin, so the basic penicillin injections work very well. But you have to clear the scabs out. So if you're starting to get scabs on the back, you're better to pick them off, remove them from the surface, and then wash the surface of the skin with a dilute antibacterial agent. We also often mention kidney scrub, but that kills this bacteria very well. Dilute it about 1 in 40. But once you've washed the sore areas, make sure you dry it thoroughly. I was going to say, if anyone's got any questions as we're going through, quite small groups, and I said, just stop me, put your hand up, and we'll have a chat about things if you've got any queries. Like other animals and humans, we do get general bacterial skin dermatitis, where various bacteria can be affected. Staphylococcus is one of the common ones. I think we all hear on the news about MRSA in humans. We do get them in animals. Thankfully, we don't see them very often in horses. But we can also see general staphylococcal skin infections on horses. Frequently seem to be on faces. Sometimes get them around girths, in the armpits where they rub as well. They are a nightmare to treat. The last one I had with a face bacterial dermatitis on the face like this, we ended up with it on antibiotics for a 6-week period. Plus topical, that was systemic antibiotics in its feed, and we also used topical antibiotics on its face and washes as well. We'd treat it for 2 or 3 weeks and it appeared to go away, and then it was back again. So in the end it had to have a 6-week continuous course of antibiotics. They're usually quite itchy as well, these horses, with these staphylococcal infections on the face. I've put blood fever in here. I think certainly years ago it was thought it was mainly a bacterial skin disease, and again Dermatophilus has a part to play in it. But over the years, everyone realises what a difficult condition this is to treat. It's generally caused by wet conditions with low oxygen. But it's not just a bacterial skin infection, it involves fungi as well. And it's usually multiple bacteria and multiple funguses in the wound. So simply giving them antibiotics is not going to make these guys better. They're always going to have some lesions left. In terms of what should we do best for them, we see some horrendous treatments applied. Once I saw someone put bleach on because they thought bleach is an oxidising agent, and these are bacteria and fungi that might put low oxygen. Unfortunately, it burnt the skin. Probably killed all the bacteria and fungi, but ended up with a nasty chemical burn on the skin. So what we need to do with these is remove the scabs from the surface to allow what we're going to put on to get to the infected tissues, the bacteria and fungi on the skin. So the preferred method is we bandage them up with a hydrogel. The one we use in the practice is Lintex. And we would completely cover these scabby lesions in the hydrogel and then bandage them on for 12 to 24 hours. Some people wrap around with cling film and keeps them moist. Usually after 12 to 24 hours you can then take the scabs off, lift them off quite easily without having to pull. Obviously these horses are sore and everyone tries to remove the scabs and pick them off and can make them very agitated and they're very sore with it. And once we've got down onto the skin surface, our preferred method now is to use a topical agent called flamazine, which is silver sulfadiazine. It's not an antibiotic, but it has antibacterial and antifungal properties. And again, we will tend to bandage this on over the lesions. Some people find it quite difficult to do, the bandages slip off. Generally, we find if you can get the bandages to stay on and follow the application course, and it is a pain to keep bandaging them, they will clear up very quickly with the flamazine. Unfortunately, some of these guys relapse, so once we've got it cleared up, a few weeks later they're back out and the wet's affected the skin again, and we're back to square one. Especially worse on white legs where there's no pigment in the skin. The non-pigmented skin is much more prone to it. I think this is probably about the most common skin disease we have to treat. I think it's everyone's biggest headache. What we don't... Hi.
So with mud fever, if you've got a horse with feathers, there's this argument. Some people say you should shave them off. Some say you should leave them on to prevent mud fever. What's the thinking behind that?
If your horse hasn't got mud fever and he's got feathers, I generally would leave them on. Once they've got mud fever and they've got feathers, really I think the feathers got to come off because you can't get at the scabs and the site of infection. The feathers are covering it.
But so keep them on if they haven't.
If they haven't got it, I think I would keep them on because it provides protection. I think probably we've all seen things like Muddy Marble and various barrier products that are in the shops. I'm really quite opposed to these. I've had a number of people trying to... The skin is naturally covered in millions and millions of bacteria and fungi that live quite happily on the skin surface. However dry and good your conditions are, once you put the barrier creams on, you're going to trap some dampness, or there'll be sweat underneath these barrier creams, and that can cause these bacteria to infect quite quickly and fungi. So, unless you can make the limbs sterile, which you can't, I think these products are generally not a great idea. Viral skin disease in the horse. We do get quite commonly, certainly, papillomavirus. We see occasionally equine herpes virus 3. That's not to be confused with herpes virus 1 and 4, which are the ones that cause the respiratory disease, the abortion and neurological form. The equine herpes virus 3 is purely an infection of the reproductive organs, and it can't cross over to the other types. And also I've put down there sarcoids. I think the latest research confirms that probably the cause of sarcoids is a cattle papillomavirus, bovine papillomavirus. So I've put that down in the viral skin disease, but we'll probably talk about it more later. Most horses, as youngsters, will be infected with equine papillomavirus. It's these horrible watery lesions over the nose, and it's like children getting chicken pox. Once they've had it, they're immune to it, and there's very few adult horses won't have had it as foals. These horrible watery lesions will generally appear over the muzzle. They can appear on other areas of the face and body, but generally they're usually limited to the muzzle. They're self-limiting. They're not used. Sometimes if you see the horse on the right, it's got a bit of bleeding with it, and those can be a little sore, but the horse on the left probably wasn't in any discomfort with them at all. After 3 months, the body will make its own immune reaction to them, and they'll clear and just drop off. So the horse's body will actually become immune to the equine papillomavirus. The one exception is if you get them in the ears, and these are called oral plaques. we don't understand fully, but when they get equine papillomavirus infection in their ears, they can't make an immune response to it, and they're left with these white or waxy coloured lesions in the ear for the rest of their life. They're non-irritant, they're extremely common. You know, it may just be a pink spot in the ear, you may get more extensive lesions like that. The only problems we see with them is when someone tries to scrape them out, clean them out, or generally irritate them, and then the horse ends up being head shy. If your horse has got them, don't worry, they're slightly unsightly, but they're not going to cause any problems, but they aren't going to go away. You're stuck with it for the rest of the horse's life. Quick Alexandrina. This is the equine papillomavirus 3. Sorry, equine herpes virus 3. And this causes sore around the genital region in both mares and stallions. So you see we've got some open sores around the vulval lips there. And the stallion, you see here, we've got these blistery spots on his penis. It's generally spread through sexual contact between mares and stallions, so unless you're breeding, they're the only ones it can really be significant in. It is a herpes virus, and herpes viruses in horses are like humans. Once you've been infected, you never get over it, you always carry the virus. However, the lesions will usually go after 2 to 3 months, so that's again self-limiting. But the horse will always be a carrier of equine herpes virus 3. With the more common use of artificial insemination, we see less and less of this. And so I think I've only seen one case this year. But it used to be far more common with natural covering, especially in thoroughbreds. We would advise if you have got a mare or a stallion with lesions of it, they're not bred from until the lesions have healed up, or they do risk spreading it. It doesn't affect the mare or stallion's fertility, and they'll still breed normally. They'll just have these nasty spots on them. Fungal infections. Common ones that people associate with fungi is ringworm or dermatophytosis. There are quite a few different species that can affect horses, but we've most horse ringworm infections are limited to 2: Mycosporum equinum and Trichophyton metagrophytes. As we've mentioned earlier, mud fever also involves fungal infection, but that's not ringworm. Ignore this one for a minute. Ringworm again is self-limiting in horses. It usually, once they get it, they'll cure themselves in about 6 weeks. However, in terms of competition and racing, a lot of shows don't want horses with ringworm on their premises because of the risk of spread to other horses. It is contagious. It's frequently spread by contaminated hands, use of tack. So we get an outbreak on a racing yard. We'll often see it around the girth, where they've used the girth on multiple horses and they spread it from one horse to another. Areas where it's commonly groomed, we'll see it as well. And it generally looks like small areas of hair loss. Often circular areas, also about the size of a large 10-pence piece, well, slightly bigger than 10-pence piece, or you sometimes get small flecky areas that will be crusted and the hair will generally lift off. It's not itchy, and the horses generally aren't sore with it. The treatments currently that we use are designed to reduce the number of fungal spores that a horse will produce, to reduce the risk of spreading it to other animals. We would say wash your grooming utensils, tack, numbness and light and so forth, in things like Virkon or hexidine, which will kill the fungal spores. We use a substance called Mavorol, which is an antifungal agent, to wash the areas in, and it won't cure it, but again it will help kill the spores. The problem with ringworm is ringworm spores are very tough, and they can stay viable in the environment for up to 7 years. So if you've got a wooden stable and your horse has had ringworm spread it all around it, you may well if you put more horses in there a couple of years down the line, you may end up with the horse with ringworm just from the spores have been left in the stable. Yeah, I mean, we would obviously advise cleaning and washing down as much as you can, but you're unlikely to get rid of all the spores. So, as I say, it is self-limiting. It's not the end of the world, and it will go away in about 6 weeks if you do nothing. Well, other common things we get called to, especially through the summer, is allergies. And there are various presentations we see with different allergies. You saw on the previous slide the horse had those soft lumps all over its abdomen. That's what we call urticaria, and that's a collection of fluid under the skin. It's frequent, that's the commonest allergic appearance we see in horses is these fluid lumps under the skin. Very easy to treat. What causes it? It could be 1,000,001 different things. With allergies, it's always something the horse has encountered previously. People, as soon as we go and say when the horse has got an allergy, people say, well, I haven't changed anything, but that's the whole point. It's not something they're encountering for the first time. They must have encountered it before for the horse to make an allergic reaction against it. And what's happening is that the horse's own immune system is working too fast. It's making an inappropriate response against something that naturally occurs in the environment. And that could be dust in the hay, pollens from grasses, insects, can be contact allergies, so things that in your tacks, something you've washed the tack in. But it won't be the first time you've washed the tack in that it's encountered it. It'll be something it's been pre-sensitized to. These urticarial lumps aren't itchy. They generally aren't itchy. If you leave them for a few days and they harden, sometimes they become itchy then. But on the first presentation, you just get these soft lumps all over the horse. And the horse can be somewhat distressed because you get severe reactions where the head will swell and they'll swell all over the body. You'll get a collection of fluid under the tummy as gravity pulls it down. But generally not an issue with it. There are groups of allergies we see that do cause pruritus or itchiness. Typically sweet itch, which is probably the most common single allergy that we know. It's an allergic reaction to midge or cubicoides saliva as they bite the horse. They're intensely itchy. We can get other allergic conditions that produce itchiness as well. And again, it can be to things they're breathing in, such as pollens, something in the food, something in the stable environment. They're not nearly as common as the urticarial reactions, apart from the sweet itch group. And we often see them in older horses, and things will get worse as the horse gets older. Again, with some allergies, we can get an immunological reaction in the skin and get thickening of the skin. We see this again in sweet itch horses, where there's thickened skin along the crest of the neck, and sometimes over the tail as well. And very occasionally, with horses with allergy, we will get eruptions or sores on the skin surface, but this is quite a rare presentation. So, there we go. Commonest allergy there is, sweet itch. We now know it has a genetic predisposition. So if you have a mare with sweet itch and she has a foal, she's quite likely to pass it on. As we said before, it's caused by the midges, and in this country with the warmer weather we've been having, you can get midges now virtually since from February through to November. And it just takes one midge to start the allergy off. It doesn't require 30 or 40 of them buzzing around the horse and biting it. One midge is enough to start this reaction. And when the midge bites, the body releases unusual amounts of histamine, which is a chemical in the skin. Once it releases histamine, the horse becomes itchy and starts to scratch. When it scratches, it produces more histamine. You see this vicious circle, as I say, one midge is enough to start them scratching. As soon as they start scratching, it gets worse and worse and worse. As you see here, the horse on the top left, that's stripped all the hair off its tail, made it raw. It's even got under some trees and got sores along its back where it's trying to rub. Picture on the bottom is the typical appearance of a horse with sweet itch on its mane. Broken hairs, lots of thickening of the skin, so you see the lines down where the skin is thickened. In the last, I suppose, 10 to 12 years, the big step forward has been the use of these barrier rugs. And if they're used properly, they are very effective at stopping the allergy. As I say, once a horse has developed an allergy, we cannot make it go away. That horse has got the allergy for life, so we can only treat them, we can't cure them. Just going back to Sweet Itch for a minute, in terms of products available for use, I think the old one, certainly when I was riding ponies, was benzoyl. We can still get that now, but it's quite irritant to hands and stuff, and you need to put it on daily. But it's quite an effective repellent for the midges, so you would apply it on a daily basis to along the mane, the tail head. And the other place they can show Sweet Itch signs, which people often miss, is what we call the ventral midline, so right under the belly, right from between the front legs, right back to the udder or the sheath. So we also say apply it along there. It's quite effective. As I say, if you get it on your hands and you wipe your face, it'll make your eyes run like mad because it is extremely irritant to humans. Temporary relief, we can use corticosteroids to treat them. Obviously, I think everyone's aware of the theoretical risk of corticosteroids and laminitis. Preferably, we use short-acting corticosteroids in a tablet form called prednisolone, starts off possibly with an injection. Some chronic horses that are in full work, we will occasionally give a long-acting steroid injection to that could be repeated every 4 to 6 weeks, but that does have a slightly higher risk of laminitis, so we're quite reluctant to do that. As I said with the last picture, the rugs are the best thing we can use. But what we have to ensure is that the horse isn't bitten at all, otherwise it might start reaction off. So you must use the rugs all the time, inside and outside the stable. The one danger time is when you're riding the horse. Obviously you can't ride the horse in the rug. So again, effective fly repellents, either benzoyl benzoate, something with permethrin in. The citronella ones will keep some of the flies off, but I don't think they're strong enough nowadays to keep all midges off. But probably a good fly repellent with a permethrin type product in it.
Mark, can I ask you your thoughts on DH and products like that? £80 a month for the last 3 years.
Yeah, some of them, I won't pretend to know what's in all of the products, but generally the permethrin types are. The Cooper's fly repellent contains permethrin. Horseware Island actually do a fly rug that's impregnated with permethrin. I think that's a really good one. And I said you can wash it up to 25 times, it'll keep working. So it's, I don't like promoting people's products, but
no.
It's
generally most things that you find in on the shelves.
a lot of the, a lot.
Like garlic as well.
That's waste of time. Yeah.
You have to put garlic in a horse, I would imagine.
DEET seems to be a reasonable fly repellent. That seems to work quite well, but I think it's the most pleasant stuff in the world. But that seems to be quite effective. But generally try to stick to the products with permethrin type drugs. And if you look at the contents in them, they usually work quite well. And I must admit that sort of having seen a couple of horses with these Horseware Island drugs that have got permethrin impregnated in them, they seem to work brilliantly. You don't have the flies landing on them at all. So I presume it's having the same effect on the culicoides as well. Permethrin's been around for 40, 50 years. It's really safe. There's been no adverse reactions to it, so don't have any worries about using it. Things like Cooper's fly repellent have got it in. I think most tack shops have got some products with permethrin in them. Citronella does have some fly repellent effects, but I don't think it's good enough for horses with Sweet Itch. I don't think it's strong enough. So it's talking about the urticarial type reaction. That's a typical horse with a severe urticarial reaction down its neck. We rarely know what these horses are actually allergic to. It could be one of 1,001 things. If they have repeat reactions like this, there is a way of testing with what we call intradermal skin testing, and we test multiple allergens by injecting tiny amounts into a patch on the side of the neck and watching how they react over a few hours following. And once we know what they're allergic to, we can try and remove it from the environment, or we can try and desensitize them to them. So there is a way of injecting them with the thing they're actually allergic to in repeated doses. And reduces the immune effect the horse is producing, so basically desensitising them what they're allergic to. It works in some horses, it doesn't work in all of them. The problem is we usually test a panel of about 50 to 60 different products with obviously there's thousands as to what they could be allergic to. We try and pick the things that are commonly allergic to, but we can't always find what it is. So that's another reason why it doesn't always work. But a lot of those horses, people does have a good effect, whether it reduces the severity of the allergy or in some horses does clear it up altogether. And in these horses that get repeat urticarial reactions, I think it has the best effects of the intradermal skin testing and desensitisation. This is an old horse I've been seeing now for quite a few years. It's nearly 30, and it has horrendous allergic pruritic skin disease. We're not sure what it's allergic to. We can't bring it into a stable because it will rub itself to bits, and it lives on corticosteroid to control it. At 30, they decided not to have it skin tested to see if it got any better, which was quite reasonable. But you can see the sores down its shoulder where it's rubbed itself. One of the worst things, if it can get to a post or anything, so its whole field's got an electric fence around it, it'll rub around its ears and cause sores around the base of its ears. And it can get quite distressed if it's allowed to. So we control this with corticosteroids. As I said, these reactions do get worse with age, and this horse we're finding it more and more difficult to control, even with greater doses of steroids.
Is that the same for sweetage? That gets worse over time as well?
Generally not. Sweetage seems to get to a level and then stay at that level. My first pony had sweetage, and it didn't, certainly lived to about late 30s, and it didn't get any worse when it first started at about the age of 10 through to the day it died. And certainly the ones we see, sweetage seems to stay at the same sort of level, gets worse to a certain point, and then once at that point it just seems to stay the same. These pruritic allergies, the allergies of itchiness, they do deteriorate over time. Same in horses with recurrent area obstruction, or what used to be called COPD, with these breathing allergies, they will get worse over time. So we try and control it best we can, but as they get older, the allergies will get worse and worse.
The first one you showed, first one, the lumps, do you do anything about those? Or do you
What,
just
the soft
ones, yes.
Yes, generally I first put them on a short-acting corticosteroid, and often they'll go down overnight if it's a simple reaction. If you leave those allergic lumps alone, they can form crust on the surface and ulcerate. And then you've got sore areas, often over the saddle or the girth area, and those will be itchy. But if we treat them quite quickly, usually with often a single dose of corticosteroid injection that just lasts 24 hours, they'll go down straight away. Tumours. I've put down the three common ones that we really see in skin tumours in horses. Sarcoids, melanomas, and much less common is squamous cell carcinoma. The squamous cell carcinoma is a malignant tumour, whereas the other two are what we call benign. They only act by local spread. If you went through the literature, there are many other different types of tumour, but we rarely encounter them, so I don't think we need to talk about them here. Sarcoids now, they're a nightmare problem. We see them at vettings, and they cause huge questions when we're doing pre-purchase vettings. They can cause significant problems for horse owners, especially when they're around the eyes, in the girth area, or when they're multiple and ulcerated around the horse and they're affecting his movement. So we divide them into 4 different types, roughly according to their size and location. We have the varicose sarcoid, which is the wart-like one, so you've got quite a crusty, rough surface on it, and then we've got 2 varicose sarcoids just below this horse's eye. Common one a lot of people see are these fibroblastic, so they've got a fleshy hemorrhagic surface to them. See this horse has got multiple ones under his forearm, hanging down there, quite revolting. Then we get the mixed ones, so you can get a combination of the varicose sarcoid in the middle there, so we've got several small varicose sarcoids, and a fibroblastic one on the right hand side, and that's probably a fibroblastic one on the left. It's just got a bit of a scab on it. Occult sarcoid, we can see that the flat, crusty area. I haven't got a picture here, but we also get nodular sarcoids which are covered by skin. So the mixed is really a combination of the first two types, the varicose and the fibroblastic. These flat occult sarcoids, they're more cosmetic than anything else. They don't seem to spread too much and don't generally cause a lot of problem. But the nodular ones can get quite big as well. Sarcoids are an absolute nightmare to treat. There is no single successful treatment. I think you can see by the list of all the different possible ones here. As I said earlier, I put them down under viral skin disease because we're pretty sure now they're caused by a bovine papillomavirus, and that's likely to spread by biting flies. So again, wound treatment's important, that you don't allow large ulcerating wounds. If a biting fly comes along and gives your horse a bovine papillomavirus, you can often get a sarcoid develop out of what was the wound. The top one is the Liverpool cream, which if people have had sarcoid, a lot of you will have heard about. The veterinary school at Liverpool University has developed, in conjunction with a practitioner, a cream that is cytotoxic, so kills the sarcoid cells preferentially. It goes under the code AWLUBES. That stands for Alan Walker, who was basically family that the original recipe came from the sarcoid. He was a veterinary surgeon in Oxfordshire, Northern Oxfordshire, and I was very lucky to see practice with him as a student. And the recipe for this cream had been handed down from his great-grandfather, and his father and grandfather and great-grandfather have all been what they call veterinary practitioners, so non-qualified vets but went around treating horses. And Alan was the first of the line to actually be a qualified veterinary surgeon. So this has been a family secret, and as a student 20 odd years ago, I used to go around with Alan treating sarcoids all over the country, and you wouldn't no one else had the sarcoid cream, and this green, grey, smelly, disgusting stuff that was quite fetid. It was very effective at treating the sarcoid, produced massive reaction. It then got handed on to a guy called Professor Derek Nuttenbelt, who went to work at Liverpool University. He'd known Alan for years. And Derek refined the cream, so it's now a nice white paste. It doesn't smell quite nearly as bad, but it's just as toxic. It's a secret as to what exactly is in it. I know there's quite a lot of arsenic, quite some nasty anti-cancer drugs in it, but it does work reasonably well, better than most of the other treatments for sarcoid. I would say it generally has about 60-70% success rate of clearing them. Because it is so toxic, Liverpool absolutely insists that it's only applied by veterinary surgeons for the risk that a client got it on their hands or something. It could cause quite nasty skin lesions. So that's generally a preferential treatment. Other treatments, we can cut these out. The problem with sarcoids, if you don't get the whole sarcoid, including all the roots, which we can't define because we can't feel them, we can't see them, they will spread rapidly. So the less you get rid of the whole sarcoid, you may make matters a whole lot worse. So with some, we do occasionally use sharp surgical removal, and we make sure we get a large margin around them to remove and cut it out. We also use cryosurgery, and that's freezing the sarcoid tissue. And we can use the sharp surgical removal and cryosurgery in conjunction with one another, where we cut the bulk of the tumour out and then we'll freeze the base to try and kill the tumour cells by freezing them and causing some rupture. Radiotherapy. The two of the veterinary schools, the veterinary school at Cambridge University and the veterinary school at Liverpool, both use radioactive isotopes in treatment of sarcoids. It's quite dangerous to humans, and generally what they'll do, they'll put radioactive wires or iridium wires through the skin in close proximity to the tumour tissue and allow the radiotherapy to kill the tumours. Can leave quite significant scarring, but it's useful in some of the extensive sarcoids, especially around the eyes, to treat those. We can't use the Liverpool cream close to the eyes, it could cause so much damage with blinding balls, because they do get severe inflammatory reactions to it. Lately, some people have been using laser surgery, but laser surgery I think doesn't work too well because you can only direct it on the parts of the tumour that you can see. Immunomodulation. We do occasionally use BCG, the human BCG vaccine in periocular sarcoids, so sarcoids around the eyelids, and we have a series of injections into them, and the body seems somehow then to make an immune reaction and remove the sarcoid. And in those few small periocular sarcoids it's used in, it seems very successful. A lot of people ask us if the sarcoid's hanging off to band them. It's something I don't like doing. I think it's you won't remove all the cells out of the base of the sarcoid, and you'll cause vast, rapid spread. And I think see horse after horse, and they said, oh well, we had the sarcoid tied off or banded off, and now we've got 4 or 5 in its place. So I really don't like doing that at all. The next common tumour we see in grey horses is melanomas. These are quite severe ones, so we see you've got multiple melanomas under the grey area, on this grey horse's tail, around the dock. It's a very common sight for us to see them. And then this horse has got some large melanomas under the skin. If you cut into those tumours, it'd just be full of black inky fluid. And they're local benign tumours of the melanoma cells that normally occur in the skin, give the horse's skin that dark coloration. If we catch them early on and we have single melanomas, small melanomas, it is possible to cut them out surgically because they're well defined, and we can remove the whole melanoma in place. That's probably nowadays is the best option. So if you find a single melanoma under your tail or around the horse's dock, we can often remove them with local anaesthetic and sedation and get rid of the whole tumour straight away. Once they've spread and we've got multiple large ones, we're very limited in treatment options. Surgery in either of these cases here wouldn't be an option. About 2/3 of horses will improve with a drug called cimetidine, which is a human anti-ulcer drug, and we can give a 3-month course of oral cimetidine tablets to the horse, and it will reduce the size of the melanomas in about 2/3 of horses. It won't get rid of them, but it will just reduce the size. And if we've got large melanomas around the dock, which are making it difficult for the horse to defecate, then that can be quite relieving for them. But as I say, it only works in about 2/3 of horses, and it only reduces the size of them. But once they get to this level, that is our only option currently in terms of treatment. Squamous cell carcinomas. These are malignant tumours. Just like squamous cell carcinoma in humans, these will spread and invade other tissues within the body. So metastases can occur in the lungs, liver, kidneys, any organ throughout the body. They usually occur on the non-pigmented skin, so the pink areas. We see them frequently around the sheath. So this is a squamous cell carcinoma on the sheath of the horse. We can see them on the muzzle, the eyelids, third eyelid in the corner of the eye, the pink bit, the little pink fleshy bit in the corner of the eye. We frequently get them on. We even get them on the eyeball itself. There are various different treatments to use for them. I think most people will try and surgically remove them all in entirety as preferential, and you would use a clear margin of excision. I know quite a few around the eyes have been treated successfully with cryotherapy where they've been frozen. And what freezing does is we try and freeze all the cells of the tumour, and then we allow it to thaw out. So when they freeze, you get ice crystals form within the cell, and as they thaw out, the ice crystal expands and ruptures the cell. So to try and make sure we kill all the tumour cells, we usually put them through 3 or 4 freeze-thaw cycles. So after you freeze it, allow it to thaw out, freeze it, allow it to thaw out. We generally do it under general anaesthetic, because just on the time basis of it, it does take a while to allow it to freeze it and then thaw again. Okay. Parasites. Quite a range of different parasites cause skin problems in horses. Commonest ones, some of the commonest ones, especially now coming to this time of year, will be lice. Horses suffer from relatively few mice. There are 2 or 3 species we see causing problems. Commonly the leg mite or the leg mange. We also, this year, I've seen a few cases of a thing called neotrombicular, or the harvest mite, affecting the face of horses with the dry sandy soil. The poultry mite can affect them as well, but apart from that, there's relatively few species of mite. Sarcoptic mange in horses is not present in the UK and hasn't been present here for some time. It is actually a notifiable disease, so if we found a case, we'd have to report it to the government. Various biting flies affect horses. Bots, again, this time of year, we often will be seeing bots on the horses' legs. I think I've seen very few bot flies this year, fewer than I've seen for many years. And pinworms as well cause itchiness around the tail. So, 2 types of louse in the horse. On the left we have Damolinia equi, and that's a chewing louse, so it's got a much thicker head on it, and that actually chews at the surface skin of the horse. And then we have the sucking lice on the right-hand side, which is Hematopinus acini. It's got much narrower mouth parts, and that will bury into the horse, and that sucks blood from the horse. So, both thoroughly unpleasant. To naked eye, you won't be able to distinguish them. Commonly, we'll see large lice numbers around the mane, and often you'll get hairless patchy areas on the face. The picture on the right is quite magnified, but you can see these are all actually adult lice around the hair, chewing into this horse's skin. We see larger numbers in horses that in welfare cases, so emaciated, thin horses or horses with compromised immune system seem to attract many more numbers of lice on them. Typically, you'll see the hair loss, the itchiness, broken hair around the mane and tail, the face. If you get very large numbers, these horses can be anemic as well because they will suck blood out of the horse. But it would take vast numbers to actually make the horse anemic. Leg mange, this is under a microscope, and this is the commonest mange mite we see in the UK. It's virtually solely seen in feathered horses, so horses with thick hair on the limbs, Coreopsis equi. These are 2 horses with the one on the left is one which hasn't been clipped, and you see these bloody, itchy lesions, and they're caused by the horse irritating itself, because it will stamp its feet, it will kick itself with the opposite leg, it will scrape each legs up and down one another, back into gates, any hard surface, and scratch itself, will traumatise themselves quite badly. For some reason, they only go up to the hock or the knee, so we don't, the mites won't go above that sort of area. Once they've got these mites, they are difficult to treat. We can control the numbers with using a drug such as Dectomax, which is a cattle wormer. It's not licensed use in horses, but it will reduce the numbers of these mites and make the horses more comfortable. And that's an intramuscular injection, and we'll repeat every 2 to 3 weeks as necessary. You can get rid of them altogether, but it's quite a job of work, and it doesn't always work. But if you clip, because these mites like living in the long hair, you clip all the hair off from just above the hop to get right down to the hoof, and from just above the knee right down to the hoof. So you've got 4 bare legs. It's no just think, oh, well, it's only got 1 leg. If it's on 1 leg, it'll be on all 4 legs. So clip the hair off, make sure it's dry, and then use the dog frontline spray, which contains a drug called fipronil. And you have to actually fully saturate the limb in this, so it's soaking wet, rub it in thoroughly. Then must allow the horse to stay in, and the leg must be completely dry for 4 to 5 hours to allow the drug to attach to the hair follicles. Having done this once, you leave the horse for 3 weeks, and then you repeat this whole process again in 3 weeks' time, and you repeat it again in another 3 weeks' time. And if you're very thorough with it, it will remove all these Coreopsis equi off your horse's limb. It doesn't stop the horse being reinfected, so if you are in a group of horses with a lot of feather on them, you may well get reinfected immediately from the other horses. But if you're in an individual stabling and not turned out with horses with a lot of feather on, you should be able to cure this, the leg mange from the horse. Harvest mite. This is one's called Neotrombicular automalis, and I've seen 4 or 5 cases of this year, and it's not that common. I think the hot, sandy, dry conditions we've had in the summer have increased the number of these mites, and they basically jump on the horse's face when it puts it down to graze. It lives in typically sandy, dry soils. They chew away at the horse's face, causing irritation, and then the horse will traumatise itself. So most of the hair loss around that horse's face is caused by the horse rubbing itself. It's self-traumatising because of the irritation. Very easy to treat the Dectomax injection we just mentioned. Usually a couple of injections of that, and these will get rid of these guys completely. They're not. The horse isn't the primary host for these harvest mites, so they're not too difficult to get rid of. We've mentioned about culicoides. They will cause irritation to other horses other than those with just sweet itch. So you've got a culicoides midge on there, biting, chewing away. So there are lots of midges, especially in places like Scotland on the west coast. You'll get clouds of these midges. They will cause intense irritation, and you often see horses and cattle galloping around with irritation from these midges. And it's not they're allergic to them, they're just being bitten so often. Stable flies, they will cause some irritation to the horse. They don't generally bite that much, but the action of them crawling over causes a problem. These fellas, the Savannah's horseflies, I seem to get bitten more and more frequently by these myself, and yes, they hurt. We're trying to examine the horse in the summer, they can be infuriating with them biting and coming over. And as we've discussed about fly repellents earlier, fly rugs, all these things will help keeping these biting flies away. Bot flies. They generally aren't too much of a skin problem. We all see the white yellow eggs being stuck on the front legs. The main problem is larvae, because the horse they cause minor irritation to the legs, and the horse will rub and chew at its legs. It will then ingest the larvae, and they form the bot larvae that attach to the stomach lining and pass them out like that. I also do quite a lot of gastroscopy. When you put this time of year, when you put the video camera down, it's collecting these larvae stuck to the horse's stomach lining. People have a fit. They actually don't cause much of a problem. They're horrendous to look at, but in terms of sticking to the stomach lining, they cause some minor bits of reddening, but generally don't cause too much of a problem. But occasionally, if they've got a lot of the bot eggs stuck to the front legs, they will chew it themselves and cause damage. Ticks. Again, the horse is sort of a secondary host for ticks. They won't generally jump on horses out of choice. It's mainly deer, sheep, cattle they prefer. So usually we only see the odd one or two ticks. If you live in an area with a lot of bracken and gorse, then you might get a few more on your horse. They'll cause local irritation around where they bite. Frequently they'll get infected because they inject their own little bit of local anaesthetic, then stick the head part straight through the skin into a blood vessel and fill it with blood. So we've got the bottom right is a small tick that probably hasn't had a feed, whereas the top left is a tick that's full of blood. So if you squash that, it just come out red with them, where it's just had a huge feed of blood. The main problem is if they get knocked off and they leave the head parts in, they can cause local skin infections. They can be removed with tick removers, little plastic tweezers with a V cut in the end, and you gently put it around the head of it and twist it up and gently remove them out. It's very easy to leave the head parts in which case you'll probably get an infection or a little bubble of pus there. They can spread diseases to horses, and there have been a few cases of Lyme's disease in horses in this country. It's not common, and just if your horse has got a tick on it, it's definitely not going to get Lyme's disease. But it's probably better to keep these off. If you've got any dog frontline around, spray them with dog frontline, they'll drop off after about 4 or 5 hours. It kills them quite nicely. Just going to talk about a couple of things. Horse's skin, like skin of any other animal, can be damaged by noxious chemicals or burns. So this horse on the left is one that was caught in a fire, and you can see there's quite large areas of skin are actually going to slough off this horse. So this is in 24 hours after it had got burned, but it's likely to lose all this area of skin here, 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 and here, exposing the flesh underneath. If you do get a horse that's burned, just the same advice you give to humans: pour lots and lots of cold water on it. Skin will retain heat for a long time, so you should be pouring cold water on it for at least 20 minutes. It's not just cover it in cold water and leave it. You need to keep flowing cold water going over it. and call us immediately. The horse on the right had a bacterial infection in its muscle. This was caused by injecting it with a cattle wormer. It was done by a huntsman in the kennels with those horses, and thought to save money he'd use a cattle wormer on it. As he injected the worm, he introduced a bacteria called a Clostridia, and it caused the muscles to damage and erupt like that with large loss of skin area. This horse subsequently recovered, but obviously had massive scarring. So it's just a word of caution to be careful as to what we do. I've only ever seen 20 odd years, I've only seen 2 cases of Clostridial muscle infection, so it's not common. I'm not really going to talk about this. There are a rare group of disorders which we call autoimmune diseases. This is when the horse's own immune system goes wrong. And what it does, instead of recognising its own tissues as normal and protecting them, it recognises its own tissues as being foreign and starts to attack them. And you can see here this pony's going to have large areas of crust and skin lifting off, where its own cells are attacking its own body. This is also a condition called pemphigus foliaceus, but there are a number of skin diseases that are causes autoimmune skin diseases. Generally pretty bad news. The only way we can treat them is to suppress the immune system. That means they are susceptible to lots of other diseases. Because we can't selectively take out the bits of the immune system that's causing the problem. We have to suppress the whole immune system. So very expensive drug medication to keep them going, and often we can't control it, and unfortunately it's the end of the road for these guys. Just put this one in. Commonly in summer, especially with horses with non-pigmented skin, you'll get sunburn. However, just to making people aware, not all crusting and sores on the nose is primarily caused by sunburn. We also get what we call photodermatitis, which can be caused by liver disease. So if your horse, as you're covering your horse's nose with sunblock and it's still getting these crusts, be aware there may be other problems going on. And this is when what we talked about earlier, is the skin being an indicator for other diseases. The horse on the right, its skin is indicating it's actually got problems with its liver. It's not primarily a skin disease. Okay, I think we're about there. So, hopefully I've covered most of the common things that you're going to see. There are literally thousands of different skin diseases, but most of them thankfully are quite rare. If anyone's doing questions, far away.